Well, hello everyone, and welcome to this town hall discussion held by ACYPL in partnership with the Northern Ireland Assembly Public Engagement Office. My name is Natalie, and I am a senior program officer at ACYPL, and I am especially delighted to be moderating this conversation today. This region of the world is very close to my heart, as I used to live and work in Dublin, in the Republic of Ireland, so I'm thrilled to have the opportunity to talk with our distinguished speakers for MLAs or members of Northern Ireland's Legislative Assembly. While the globe has experienced this pandemic together, it is vital to share individual experiences, strategies of response, and outlooks for the future. This is how we learn from one another, and time again, the world has come to understand much can be learned from our friends in Northern Ireland on a variety of issues. So again, ACYPL is very happy to host this conversation, and it is my pleasure to introduce our speakers. First, Dr. Kiva Archibald was elected to represent East Derry in 2016 in the Northern Ireland Assembly. She is the chair of the Committee for the Economy. She is also a member of the Ad Hoc Committee on the COVID-19 response. Prior to her election to public office, Kiva worked on several scientific research projects studying mushroom and horticulture pathology. She has long been involved in political activism through her party, Sinn Féin, and we are proud to call her an alumna of ACYPL as she traveled on an exchange to the United States in 2017. So thank you, Kiva, for remaining involved with us. We are joined by Ms. Paula Bradley, who has served as an MLA representing Belfast North as a member of the Democratic Unionist Party, or DUP, since 2011. She is the chair of the Committee for Communities, a member of the Ad Hoc Committee on the COVID-19 response, a member of the All-Party Group on Animal Welfare, and chair of the All-Party Group on Homelessness. Prior to her election as an MLA, Paula was a member of the Newton Abbey Council from 2005 to 2010, eventually serving as deputy mayor and mayor. She has also worked as a social worker at the Antrim Area Hospital for a number of years. So thank you, Paula, for joining us. Next, we have Mr. Colm Gildernew, a Sinn Féin member of the Northern Ireland Assembly. He was elected in 2017 to represent Fermanagh and South Tyrone. Colm is the chair of the Committee for Health and is also a member of the All-Party Working Group on Women's Health and a member of the Ad Hoc Committee on the COVID-19 response. Prior to his election as an MLA, Colm served as chairman of his local Sinn Féin Association branch. Colm is also a founding member, former chairman, and current director of the Agaloo Credit Union and a founding member of the Braintree Area Rural Development Association. Thanks for joining us, Colm. Finally, we have Mr. Colin McGrath, who has represented South Down in the Northern Ireland Assembly since 2016. He is the current chairman of his party, the Social Democratic and Labour Party, or SDLP. Colin is the chair of the Committee for the Executive Office, in addition to serving as a member of the Assembly and Executive Review Committee, a member of the Business Committee, and as a member of the Ad Hoc Committee on the COVID-19 response. Before taking public office, Colin was a youth worker in the Patrician Youth Centre in Downpatrick for 17 years, and therefore has prioritized youth issues, among other things, in his work as an MLA. Thank you, Colin, for joining us, and thank you to all of our speakers for giving their time and expertise today. As I mentioned, they are all members of the Ad Hoc Committee on the COVID-19 response, so you can imagine how busy these folks are, and we're just delighted to have their perspectives. I'd like to actually hear from everyone about the structure of the COVID-19 response in Northern Ireland, and we'll start with Paula, because I'm curious who crafts and puts restrictions into place, first of all, and does it change at the local levels in villages or counties?
Okay, thank you very much, and thank you for your invite to take part today. Very early on in the pandemic, I suppose at the start of last year, we were very much led by Westminster government and followed the UK measures, but it became very clear early on that Northern Ireland needed to take its own steps and needed to bring in its own restrictions and a strategy for itself. We very much, as people will know, we are a five-party coalition, and that forms our party. That forms our Assembly executive, and our executive then takes advice from the Chief Medical Officer and virologists on the steps forward and what we need to do. And that is done along with our health minister. So very much those decisions are collective decisions that are made right across all of those five parties that are then brought to the Assembly for elected members to debate and discuss in the Assembly. Those restrictions and are right across the Assembly, right across Northern Ireland, every part of Northern Ireland. There is no deviation on any of that. It's for all of our communities within Northern Ireland. Though there have been occasions when that has changed, when we had maybe lightening of restrictions, where some restrictions were lifted. There were areas, I could think of one was Derry and Strabane Council area at a time had to remain with the restrictions in place because of the high prevalence of COVID cases in that area. So that has happened. But generally, on the whole, whatever is decided through the executive and through the Assembly applies to everyone within Northern Ireland.
Very interesting, coming from the United States, where we kind of have to look up the restrictions every time we move around to another state, if we are moving. I guess we're getting to that point now, but thank you for that information. So thinking about this ad hoc committee on the COVID-19 response, Colin, I'd like to ask, what is the primary role of this committee and how does it interact with other leadership, for instance, the executive office?
Okay, thanks very much, Natalie, and thank you for the invite here today to participate in this event. And I totally agree with what you say, that we can learn from each other and learn from our experiences, because this is a global pandemic and we're all responding in our various different ways in our different countries and different regions, but we're all facing the same problems. So it's good that we get opportunities like this to learn from each other. The structure of the ad hoc committee, in essence, was primarily about information. The structure that we have within the Northern Ireland Executive is that we have the executive itself, which is effectively a cabinet, which is making decisions, and as Paula said, had representatives from all 5 parties on it. But as they took the decisions, obviously we as elected representatives, there are 90 members, so there's another 81 members or 79 members of the actual assembly that aren't part of the executive. And we were getting bombarded with questions. What does this restriction mean? Can I travel here? What, do I go to school? Do I not go to school? You know, will the shops open? What type of shops can open? We were getting bombarded by all these questions. And in reality, we sometimes, if a decision was taken on a Wednesday, it could be another week before we would actually be back in the assembly to be able to raise the questions. So a very smart decision was taken by somebody at the start that said, well, let's form an ad hoc committee. Ad hoc by its very nature, it's for something quite random, and that the pandemic arriving wasn't something that was structured or planned or organized. So the ad hoc committee was established. That allowed the executive, the ministers, at very short notice to call the ad hoc committee together, maybe with just 24 hours notice. And I think there may have been occasions where it was even less notice, bring the committee together. All 90 MLAs could get into the chamber. We could hear what the decisions were that were being taken. We could tease them out in question, because there were some of the restrictions that were, you know, that they were quite confusing. You know, shops may open. Well, what type of shops? Food shops. Well, what type of food shops? Because these were all the sort of sub questions that we were getting. And the fact that we were able to then quiz, I suppose, the ministers and ask them for clarity allowed us then as 90 members of the executive to have the clear run of what was happening from the assembly and go out and spread that word around. But the decision was taken by the executive that was almost delegated to them. The technical process for ratifying them by the assembly is actually 6 weeks after the decisions are taken. They then come to the assembly for approval, which is a bit ironic, and I'm sure we'll flesh that out later in the conversations. But the ad hoc committee was about giving all the representatives information and allowing us to go out there and cascade it out into the public.
Interesting. Okay, so just to make things more efficient and actually work, sounds like. That sounds great. Well, I'd like to ask Colm, I guess I'm just going through some of your different committees, but Colm, since you're the chair of the Committee for Health, could you speak to how information is collected to guide strategy formulations? Is that where your committee kind of helps out in this realm?
Yeah, thank you. And in common with the previous speakers, I would just like to thank everyone for the invitation to take part in this, and I've been very much looking forward to it. And apologies that actually, as a result of an ad hoc committee being called at very short notice, we had to rearrange this. So it just shows how dynamic it all has been. So I suppose there is that complexity within our system, in that we have a multi-party executive. However, the legislation here was based within public health legislation. So as the Committee for Health, we were then charged with scrutinising the detail of that. I think one of the things we have always been focused on within the Committee for Health is not only how we can scrutinise and assist at the present time, but how we could capture learning for the future, for future waves of COVID-19 and for future possible pandemics. Because I think one of the things that COVID-19 did across the world, and certainly in the Western world, was exposed the reduction in public health infrastructure, in public health experts, and I think in data as well, I have to say. And part of what we were struggling with for large parts of it was that a lot of the data wasn't particularly relevant to the situation here on the ground on any given day, with the result being, for example, contact tracing was stopped as a decision by the British government when cases reached a certain threshold, and they were quite high in England at that time. However, we still only had 42 cases here, and we probably still could have continued with the contact tracing. But I think, as Paula said, we very quickly realised we would have to be more flexible and dynamic than that. Data also has been an issue north-south, where the jurisdictional differences have created some barriers in terms of us working effectively and quickly north-south. So again, I think that's something where we can, and the committee has sought to kind of focus on how we could improve all of that operation. And I think more generally, actually, what this has demonstrated is that we need, as a society, to have a proper conversation and discussion around how we do research, how we do public health better, and that these are not things. So sometimes that's the part of the budget that gets cut first, is the research grants and things like that. There, actually, we need to have a really dynamic understanding of public health data and be able to respond in real time in local situations. And given that we have two very closely connected islands and two separate islands, we need to also figure out how we work better on each of those islands and between the islands generally to protect public health.
Definitely. And I'll stick with you for a second, just because I had another question. And while we're on this topic, I think many viewers may know that generally people can travel between Northern Ireland and the Republic of Ireland freely. So what challenges has that posed in terms of restrictions in one place versus another? And to what degree was there sort of, an understanding that you'd have to communicate about this or agree on something?
Yeah, I think there is a very broad understanding. And the thing about it is, I think what needs to be understood, first of all, is that not only can people travel across the border, but people must. We have really a very deeply integrated. So, for example, it's estimated that there are 30,000 carers who travel across the border on a daily basis to provide care for parents or loved ones on either side of the border. We have over 90,000 vehicle movements back and forward in terms of just day-to-day living and working. Very many of our population have a GP on one side of the border and live on the other, or maybe a pharmacy on one side of the border. So there's really, what we really need to do is consider how we can facilitate all that, because those, and our economy is also very deeply integrated. Our food chains are very effectively integrated north-south, and some food products travel multiple times over the course of a number of days. So that is an area that we need to, I think, focus on and improve on, and to ensure that we have the best possible and the most effective coordination of measures and of messaging, so that everyone knows what is expected of them at any given time.
Okay, yeah, that makes sense. Well, Kiva, I'd like to ask you, since we're talking about, okay, so we know how generally maybe these measures are coming into fruition through the government. I'd like to ask, how are they enforced in Northern Ireland, or how were they? I know that maybe they're easing up now, but how were guidelines and restrictions enforced, and what considerations for the economy and for business were factored in when crafting these health guidelines? You're muted.
I guess somebody had to do that. But no, I just, like everybody else, would like to thank you for the opportunity to participate in this. I had an amazing time on my exchange with ACYPL when I visited the States. So just thanks very much for the opportunity to continue to engage. Yeah, enforcement has been, and I suppose to some extent it remains quite a complex area. It's quite a complex picture. Here we have had things that were put into regulation, so they were put into law and then had to be enforced, and were enforced by the police, and there were fines for breaching regulations. Then there were other things that involved like various different agencies. For example, in terms of workplace safety, that would have involved the health and safety executive, where there would be things in relation to environmental health that would have involved local council. So some of those agencies would have had statutory powers then to act on breaches that would have already been in legislation. You know, that is just part of their powers more generally. So there was, I guess, a very complex picture there in relation to all of that. There's also an added layer to some of how we've approached COVID guidance and COVID restrictions. Some things are in regulation, and then there are some things that are in guidance. So the things in regulation, you are breaking the law if you breach those, whereas the other things you are advised to do them. So it's not breaking the law; you just should do these things. So we, I think, on the whole, have seen very good compliance with regulations. People have been really good. Certainly there've been, you know, some frustrations over the course of the last year and a bit, but the actions of the public really have been what have suppressed the virus and got us to the point where we are today, where just this afternoon more restriction easings was announced. So that's a really positive thing. Early on in the pandemic last year, there was an engagement forum that was set up, and that involved representatives of like government, all of those agencies that I talked about there, business organizations and trade unions. And it brought all those people together, and it provided a kind of a platform for discussion and I guess collective agreement about how to deal with some of the issues that were being posed, particularly in the workplace, you know, where people were very concerned about their personal safety or that of their workmates or their families. And it was quite difficult. Everybody will remember when things were closing down. And there were those questions about what were essential services and, you know, what should be open and all of those things. So that provided a really useful forum to have that discussion, to find agreement, find common way through things. And now within the executive, there is a task force on COVID. And one of the areas of work of that task force is what's called adherence, so really compliance to the regulations. And again, that involves all the various agencies, and it works with the executive and the likes of the health and safety executive, but also very strongly with local councils, because we might be a small enough area, but I suppose getting things out into, you know, even more localized areas is very helpful as well. And throughout the course of the entire pandemic, the approach to enforcement generally has been on the basis of what is called the 4 E's. So it's about engaging, explaining, encouraging, and then as a last resort, enforcing. So that is the approach that has been taken and predominantly taken by the police as well in respect of how they have dealt with things. So yeah, look, enforcement has been complex, and I guess it will remain while unfortunately restrictions have to remain, but hopefully we are on a positive pathway and can stay on it.
Yeah, absolutely. Well, it sounds really good. I'm glad to hear that people were mostly compliant. Well, I guess I'd like to ask also, I'll turn this to Paula to round out this kind of segment of this. You know, over the winter time here in the US, we had a significant spike in cases, in deaths, unfortunately. And then eventually that has eased down with the help of the vaccines. So I'm curious, was there a similar situation in Northern Ireland with that winter spike? And what were the highest level restrictions at that time? And then, of course, how do things stand now? Kiva just mentioned that things are easing up. So what's the story with restrictions and movement and guidelines?
Yeah, whenever I looked at this question earlier, I thought, my goodness, October, November seems like such an awfully long time ago when we're talking about restrictions and everything else. And back in that period, we had a lot of easements within our restrictions. You know, our restaurants had reopened, our close contact services like hairdressers, things like that had reopened. And then we started to see then that increase in COVID cases. As someone who worked for the health service and worked in a busy acute hospital for a number of years before becoming a full-time MLA, I knew about winter pressures and how how our hospitals come under immense strain around that time of the year. But I mean, I suppose the flip side was that we didn't see those general increases in winter pressures, albeit certainly there were pressures put on us with COVID. So whenever our economy was open slightly around that period, right up and to allow the economy as well to benefit from that pre-Christmas retail as well. And then we arrived at Christmas Eve on the 24th of December, and everything closed down. Everything shut down. It was back to that work from home, stay at home message, and that was all non-essential retail. The only businesses that were really allowed to stay open were those large multinational supermarkets, and that was about it. Very little else was allowed to open, and the message was still being pushed out there. If you can work from home, you work from home, you stay at home, you shop local, and that message very much was there. And you stay within your bubble. My bubble was my parents, so they were the only people that I was able to see for a period of time. So that happened, and that was with us for a very long time. And my colleagues can correct me if I'm wrong here, but I think then it was, I'd written down here, the 12th of April was the first that we started to see a little bit of movement, and that was the likes of our garden centres being able to open, our car sales being able to start again, those outdoor venues being able to open and operate again. Though that stay-at-home message was still in place throughout that period, and people were still encouraged, if you don't have to go out, don't be going out. And then eventually then we started to see then our close contact services open, the likes of our hairdressers and beauticians, which was great, because for many of us, we hadn't been near a hairdressers for many months. We saw them open, and they were given a week prior to non-essential retail opening to allow them that time to open. So we're at the stage now where we do have our non-essential retail open. And I know there has been announcements today. I haven't heard any of the announcements today, but I assume they're going on what the plan was. So yeah, so we certainly, and I hope, I think 24th of May is our next big date. So I can see heads nodding, that's good. When we will start to see indoor, whether that's restaurants, or bars, or hospitality sector, who have suffered greatly during this pandemic, that they will reopen again. A lot of what we did during those months from Christmas Eve up until April was very much to protect our school children. And I know we're going on to talk about that later on, so I'll not say much more than that. So that, there had to be decisions made as to, what was important. Was it important that our children were educated and back into routine again? Or was it important that our economy and hospitality opened up? And, they're all hard, they're difficult decisions to make. But I think, I know personally speaking, that this period from Christmas to now has been extremely difficult. I think it's because of the winter as well, when we're indoors more and we're not being able to go outside and meet up with our family and friends in parks or in our gardens. But it's been a really tough few months for everyone. But I'm hoping, and again, I know we're talking about vaccinations later, that we've turned the corner, and we can see, some sort of normality coming back to our lives again.
Yeah, hopefully, definitely. Well, I'm excited to hear what happens on the 24th and what it looks like at that point. But yeah, I think before we move on, and it's kind of tying into this human impact of COVID, I would like to ask Colin what happened with schools, because talking about difficult decisions, this was a very difficult topic to figure out here in the United States, of when to open schools and how to do it safely. So are kids back in school in Northern Ireland, or what happened?
Well, yeah, okay. I think first of all, just to agree with Paula about it being such a long and dark winter. If you look around Northern Ireland today, you'd think we're still in it. The rain has been bouncing down from middle of the night, hasn't stopped all day. We've had gale force winds, so I don't know if we're moving much towards summer, but hopefully that's going to get all this sort of bad weather out of the way, and then we'll have a lovely summer to be able to get out and enjoy things. But in terms of schooling was really, really difficult, Natalie, and there's no hiding it. It did cause significant problems within a 5-party executive because there were differing views on that. There was almost half of the executive that thought, do you know what, let's get kids back into school, let's keep them safe, let's give them their education. And then there was another half that thought, do you know what, we're exposing them to dangers. We don't know what those dangers are. And also, you know, if you're locking down your community, well, if you've got thousands of school children running around your towns and your cities, and they're going in and out of classrooms, and then they're going in and out of grandparents' homes and in and out of their own homes, are they going to be these little mini carriers of the virus around? But in some respects, I don't think that we were on our own, and that I think that was pretty much where most places in the world were at. There was just that sense at the beginning of, this is new, we don't know what's going to happen here. Are we putting our children in danger? Or were people saying, well, do you know what, it seems that children should be all right? So that did cause a lot of problems. And eventually we reached that decision, I think like most places did, which was, look, let's just close schools down. Let's try and find a different way to do learning. Let's do online learning. Let's do check-ins with students and older pupils, give them more sort of remote learning, letting them be able to work themselves, but checking in with them. Now, none of those is perfect. None of those is what you want. You want your children in school, you want them getting the proper educational guidance, and you want them to be able to avail of all of the educational resources that are available within the school environment. So once we got to certain periods of being able to take a bit of easement, I know we had some changes in September where we were letting some children go back, and there was a phased return. You maybe would let some of the younger children in, then you would keep them at home and let some of the older children go, and they kind of rotated round. And that has been pretty much how it has been since. And really, it was around about Easter time, the return after the Easter holidays, that there was the return on a very slow basis, building up to all children being back in school, which is more or less where we are at the minute. But the school environment's difficult to manage. How do you do social distancing with a group of 5-year-olds? You know, and how do you do social distancing with a group of 5-year-olds that you're not teaching them something really counterintuitive to human nature, which is very, very dangerous, because that type of instruction could last with a child for a lifetime. If you tell them that they're not to hug others, or that they're not to run and show emotion to other children, we're actually teaching them something which is maybe storing up problems for the future. So I think the whole educational issue was very, very difficult. It's going to take years to trail out of that. But there has also been some groundbreaking moves within education as well. And what I mean by that is that maybe a decision taken, well, we don't just have to provide public exams that cover the whole year. Let's do public exams that cover just parts of the year, and trying to condense things down. Things that would have been seemed impossible if somebody had suggested it 2 years ago, that, you know, let's just sort of examine our children on 50% of what they do rather than the whole lot. So these have all come together to make a very unstable environment. But certainly teachers, parents, educationists have all worked very, very hard to try and keep as much stability as possible. But thankfully, everybody's back at the minute, and it seems to be going okay.
Interesting. Yeah, I didn't really think about, you know, what you mentioned about teaching kids at a very young age, what they're going to absorb and perhaps struggle to let go of, hopefully when this is over. So that is interesting to bring up. Well, I'd like to kind of turn this towards the, you know, human impact of COVID in Northern Ireland. And I guess, you know, we can just begin by asking Kiva, what industries have been hardest hit? I imagine it's probably similar to the rest of the world, but whatever you'd like to share about Northern Ireland's situation.
Yeah, and I suppose to some extent it's fair to say the majority of businesses have been hit in one way or another. There were, of course, those businesses or organizations that were really quickly able to respond to online work and were able to, you know, put in place measures, and their staff could work from home. There were others, of course, that were actually able to respond to some need presented by the pandemic and have been, you know, quite successful because of that. Like businesses here that last year diversified their operations to make PPE, for example, and have played a really positive role in terms of the response to the pandemic. But no, as has been outlined in some of the contributions there, many of our businesses and much of our economy was closed for many months since pretty much Christmas Eve. All non-essential retails, bars, restaurants, beauticians, everything, dressmakers, everything really was closed up until just a few weeks ago. I think though it's probably correct to say that the hardest hit sectors have been hospitality and tourism, because they literally couldn't open their doors. Some of our what became known as wet pubs, I don't know who thought up that one, but really traditional bars that only serve drinks, not food. Some of those were open for only 23 days between last March and Christmas, and up until just a couple of weeks ago, I think it was the 30th of April, that they were able to reopen outdoors only. From Monday, they will be able to open indoors. We're all really, really excited about that. Tourism has pretty much collapsed, as been the case around the world, and is going to take some time to rebuild, and for people to even get that confidence to get back on an aeroplane. Although I think in the executive's announcements this afternoon, some countries have gone on a green list, so some people might be able to go on holiday this summer. So that is something I think people will give consideration to and weigh up, themselves as to whether or not they want to take that risk. Because I know last year, for example, like countries were changed at very short notice and went from being allowed to travel to them to being back on the red list, and then people would have had to self-isolate when they go home. So there's a wee bit of risk associated, I suppose, with going away on holidays. But yeah, I think as an executive, and even in a bigger picture from the British government, a lot of support has been put into supporting businesses over the past year that has been really, really important to keeping them in some sort of place where they might be viable to reopen and recover, and that has been really, really important.
What measures of relief were given? Was there any sort of like stimulus for individuals, and then for businesses, what protections were put in place?
Yep. So there were both. So there were protections in terms of employees' wages. What has become another word that we've learned over the course of the past year, the furlough scheme. So it allowed businesses to put their employees on furlough, basically to put them on temporary leave, and they got a grant of 80% of their employees' wages from the British government. So that has been an absolute lifeline for businesses and for workers, because it has meant that people weren't made redundant, and it puts businesses in the position that they may be able to bring those workers back. That scheme is now in place until the end of September. The British government had tried to remove it last autumn when things were reopening, and they had tried to remove it, and they planned to remove it at the end of October, and then there was a last minute reprieve when it became clear that restrictions were going to be reimposed. So that has been, as I say, absolute lifeline. As well as that, hundreds of millions of pounds, and I know that might be kind of tiny to some of you guys listening, but that is a huge amount of money when you consider that our entire budget is about 12 billion a year. So hundreds of millions of pounds has been made available to businesses in terms of grants, which has basically kept the lights on for businesses. It has allowed them to pay things like their utility bills and their insurance, and to do those things while their employees are being able to get their wages. I think as well, we are now into this phase where we're beginning to look at reopening and what businesses might need in the time ahead. And so there is a recovery plan for that. There are some schemes being developed. One, for example, is the High Street Voucher Scheme. So every adult here in the North will be eligible for a £100 voucher. And that is basically to, stimulate people to go back out and spend money in the shops. There is kind of an opinion that once businesses reopen, and that is happening like right now, that there is kind of some sort of pent up demand. So people haven't been able to go out and spend their money. Some people have actually managed to save over the past year. So there will be some pent up demand and people will be out spending their money. So it'll be really important to time this voucher. And at the minute it's being considered that will be rolled out in the autumn. So after kind of the summer period, when things might quieten down a wee bit, that this will give a boost to our local businesses in the high street. So there's some really exciting things being planned, and I think a lot of consideration needs to be given to how we regenerate our economy in the time ahead.
That's interesting. Thank you. And I'm sorry, just one last, I think, quick question just to clear it up for especially an American audience. So you mentioned that the employees were given this scheme that was kind of like a lifeline. So were there people in Northern Ireland who just found themselves totally jobless and unsupported with no wages during this time? And who were those populations?
So there may well be people who were laid off, whose employers didn't choose to access this scheme and made their employees redundant, or whose businesses have went out of business. And so there have been people who have been made redundant. There haven't been huge numbers. And then there is another group of people, the self-employed people. And similarly, there was a grant provided for self-employed people, but it was based on tax returns up until 2018-19. So for those people who have become recently self-employed, there was no support for a very long time, up until I think just before Christmas. That is when some support became made available through the executive, but it was our ministers here in the north that put in place that scheme. And the British government didn't look after that cohort of people. So the only thing that would have been made available to people like that and to people who were made redundant is our normal benefits, which are really paltry. Like, we're talking about less than £100 a week is what people would be expected to live on. And that is really, not adequate. And actually, the pandemic has really exposed the inadequacies around our social welfare system. And I think that is something that we will all like to discuss and to look at and to see how it can be improved going forward.
Definitely. I think that would be echoed very strongly here in the United States. Well, you mentioned about tourism collapsing, which is, of course, horrible to hear about, especially for, again, an American audience where we generally love the Republic and the North, love to visit and hope that we can return soon. I think I'm speaking for many people, but certainly for myself. So Colm, I know that you have ties to the cultural sector and music and things like this. So what do you think is the long-term impact of COVID? Do you think that these things can bounce back quickly and that when we visit, when we're allowed, all of those industries will be up and running, or are there impacts that we have yet to see perhaps?
Yeah, thanks, Natalie. Yeah, I would be concerned that there will, among, the whole culture and arts, which is very rich and very vibrant here, right across the island of Ireland, but is a very fragile flower at the same time in another sense. And actually, they were deeply impacted by this because partly some of the reasons that Kiva was touching upon there, a lot of them were in very precarious work, and the nature of arts and culture work is very piecemeal, dependent on funding. A lot of people, and they weren't actually even, I think, considered by many for a long time during the pandemic. They were forgotten in a way. Was the back of house. All the staff who did the roadies set up, all their work vanished overnight. Very many were self-employed on quite low pay, and they were left unprotected and vulnerable. In terms of the creative community themselves, then once again, very many of them were involved in singing, music, dance, all of that, dependent on funding, piecemeal work. And they had the double whammy where singing and music actually was one of the significant issues that we had to deal with in terms of what was known as aerosol generating, another phrase none of us ever thought we would ever need, aerosol generating procedures. And the wonderful thing about music is it brings people together, which all of a sudden became the enemy here as far as COVID was concerned. We were trying to keep people apart. So I know personally, and I have been contacted, and I have to say it's heartbreaking, especially in recent times, from musicians who have had to hand back the keys to their van, can no longer afford. And again, their equipment doesn't lend itself to doing anything else with it. So their venues went, their ability to perform went, and for many people, this isn't just their livelihood, but their life, and this is where their passion was. And they have had to take up jobs in other sectors. And even as we start to reopen now, as far as they're concerned, the cruelty in a way continues in that we still are not in a position where we can allow people to go out and play their trade in terms of music and dance and all that. So I would worry about it, but I have to say also, I do think there is a resilience there in that people do that for the love of what they do. And I think if we can get the right support, and even belatedly now, if we can put some kind of effort into regenerating and reinstating where they were, I think there's still a huge need, and actually a huge market out there for even the story of this time to be told through music and dance and all of that. And I know that the people involved in that sector will eventually rebound if they can, but I fear that someone would find it very, very difficult.
Yeah, absolutely. I think this has been a topic that a lot of people have discussed, and with me as well. And but then you do kind of reflect and realize that so much of Irish music does kind of retell those stories of when perhaps they couldn't play for various reasons. And so hopefully there will be that regeneration after this. I'll stick with you again. Just another question on the other aspect of your life. So with healthcare, the whole industry, this was very unprecedented. And how well was Northern Ireland prepared in terms of the healthcare sector for this?
Okay, and I'll try to be as brief as possible because I know there's other questions you want to get to there. And I'm just off this afternoon, a meeting with one of our largest unions, health and social care unions. And the short answer is massively impacted because we were very badly prepared. We came into this crisis with a situation where we had been exposed to 10 years of austerity budgets, where pressure on public funding had been continually pressed down, wages were being continually pressed down in the public sector. I had worked myself before I was elected as a social worker in one of our community teams here in the older people's team. And we have an aging population here across Ireland. We were dealing, in our social work team, we were dealing with 6% year-on-year caseload rises with no recruitment for that. And where people went vacant or out of post, those posts were not filled. So we had a massive vacancy rate among, and still do, among our workforce staff, thousands of posts. Literally, we were 3,000 in a total workforce of 60,000 across all health and social care workers. We were 3,000 nursing posts vacant when a major health crisis hit. So that was the first issue. The second issue was PPE and the lack of PPE and the lack of understanding of what PPE might be needed. And in some ways, that is something I think that will have to be accounted for at some point in time, because the countries who had experienced SARS and Ebola and MERS and many of these things had recognized the need to have stocks of PPE and measures in place. We should have learned that lesson as well. I think the Western world were almost too reluctant to think that pandemics could affect us. I think that's a wake-up call, and it's something that we need to look to the future. And I have to say, I will never in my life forget the calls that we received in the early days of this pandemic from young nurses who were going into work in hospitals with no PPE, with maybe a husband or a child at home who was vulnerable to the disease that we knew was coming our way. They were in tears, but they went on anyway. And I have to say, we probably to a degree coped, but that was off the back of the workforce in terms of them stepping up to the mark. And I, you know, from personal experience, they went above and beyond the call of duty, and we will have to repay that to that workforce in terms of resting and respite, but more fundamentally, understanding they're important to us as a society and what a frontline and what a valuable and a skilled worker and a valued worker actually is. And I think, and I hope we have learned that lesson for the future. So I think that's something we need. We were already in a situation where hospitals were becoming overwhelmed and ambulances routinely in the winter time in particular, but we're running at 100% nearly all the time. And you cannot run any system on that. So there's lessons here that need to be learned and implemented very, very quickly.
Absolutely, yeah. And that would be the same, of course, across the globe. Well, just because we're talking about hospitals, I'd like to ask Paula, since you did work in a hospital for so long, just about, you know, specific populations in Northern Ireland who have perhaps been more negatively affected by the coronavirus than others. I know that in the United States, for instance, women lost more jobs than men, and for us, you know, these disadvantaged areas that we have, they still remain behind on vaccinations. So is there similar situations in Northern Ireland? What measures are being put in place if there are? And is there some sort of targeted relief or outreach to vulnerable communities?
Yeah, I think in Northern Ireland, we're no different to anywhere else in the rest of the world. It is our women that do the majority of those low paid jobs. It's our women that do the majority of part-time work. It's our women that work in that entire hospitality and tourism sector. And they very much have been hit very hard. And I know Kiva had mentioned earlier about the furlough scheme where people were receiving 80% of their salary. If you're on a low wage to start with, and you have a reduced salary even of 20%, that can make the difference between feeding your children, heating your home, all of those essential things that you need. And we have seen that here, certainly within the communities that we all represent, just how much people have suffered through COVID. I also would mention that our older population as well, not just those who are in care homes and that isolation, but those many older people that live in our own streets around us, who have suffered really, really bad and severely from isolation, reduced confidence, increased confusion. Every one of us will know someone that falls into that category. So I think that we can't forget about them either. We have seen, I am the chair of the Committee for Communities, and I know certainly through the Communities Minister, there have been some really, really good initiatives that rolled out pretty much automatically from the beginning, or from the end of March last year. We have children here in Northern Ireland, many of whom receive free school dinners and school meals. And whenever the school stopped, then that was really pretty much automatic. That they received, their parents received that financial uplift in their benefits every 2 weeks, to help with to provide those meals for their children. We developed schemes that went out and delivered food to many right across the whole of Northern Ireland. It started off with those many people who had underlying health conditions that were not able actually to leave their homes for fear of, if they did contract COVID, they would die. So those people were the priority to get food out to them. That continued from sort of April last year. That really has only just finished within the last few weeks. Where the food distribution. We also have had heat schemes to provide for heating as well, depending on what type of heating or what type of fuel you use in your home. That has been rolled out from the executive through our local councils. So there's been a lot of proactive work has been done to try and help where we can. We also have put in measures where, which is another issue as well, where if someone did receive a COVID positive test result, they were told you must self-isolate. But if you have to self-isolate and your income depends on you going out to work and your family being fed depends on you going out to work, that for some people was a very difficult choice. So therefore we had to put in what was known as the COVID-19 Discretionary Support Fund, which was for those people who were on low income, who had to self-isolate in order for them to receive a financial package to sustain them over that period that they had to self-isolate. So there were many good things that were done. We learned many lessons from that as well. But certainly on the ground, feeding and heating were seen as two very essential steps that we had to take here. And I represent that North Belfast is an area of deprivation. So it most certainly did benefit greatly from our executive and from our Minister for Communities in the initiatives that she took forward.
Cool. And that's great to hear that so many people were willing to kind of extend themselves during this time. And I think I am curious, just given what the world sees of Northern Ireland in terms of communities, in terms of division and efforts to kind of sow cross-community, community, I guess, to get people together. How do you think that COVID has impacted this? Have people kind of risen to the challenge of knowing that we need each other?
Yeah, I think, Northern Ireland, the world sees this divided society, but when Northern Ireland's back is against the wall, it is one community. And we saw that, I certainly saw that across Belfast, where you had what we would be seen as two communities coming together, cooking meals, delivering meals, just reaching out, reaching across, and helping each other, which has always happened in Northern Ireland. That has happened for many, many decades here. That is how it has been. But I think COVID certainly did bring people together, because we knew that there were no barriers when it came to COVID. It was no respecter of who you were or what community you came from. So I have to say, the Northern Ireland community really stepped up to the mark. They did some amazing, fantastic work for each other and helped each other. So that is a positive. It's not all negative. That truly was a positive. And when you saw some of the initiatives, you just thought, I'm proud to be from here. This is what we can do. We can do these things together when our backs are against the wall. So yeah, they're really good community spirit, and that's still continuing. There was friendships made and allegiances made during COVID, and I would hope that would continue into the future for many.
Yeah, I hope so too. Well, thank you for that insight. I'd like to ask Colin, I guess, during these strict lockdowns and different scarcity of resources and things like this is just the last question of this segment. How did people cope with that? And specifically, I want to ask you about young people, because it's really important, obviously, that we keep young people busy for a variety of reasons, and that we keep them engaged, not even just what you mentioned about very young children, but certainly teenagers. So what was the story with them during this time? How did they manage?
Well, without making it too big an issue, I think it would be fair to say that they probably didn't manage, because it's not normal or natural to be told that you must stay at home, that you're not allowed to interact with your friends, that you're not allowed to have that freedom of just heading to meet your friends and if we're American, go to the mall and meet your friends, or go to the local sports center to participate in activities. I suppose I would particularly think of those young people that maybe it's not natural for them to jump into activities or to reach out to other people, those that maybe did need structured activities to be able to participate and to really make them shine and develop. None of those were available during the period of time. And I think that, young people weren't even getting the outlet of school to be able to move to that. I did hear on more than one occasion people saying, thank God for technology, where beforehand we were actually saying, take that technology off children. It's not normal or natural for them to be constantly on, Instagram, Facebook, Snapchat. It's not that, keep them away from that. That actually we then saw and maximize the benefits of those, that they were able to interact with their friends. They were able, I suppose, to conduct some form of online social life, which was a very poor distant relation of what normality is, but at least it was something that they were able to do. In terms of what are the ramifications, what will be the impact of that, I think it's going to take us a long time to find that. There will be a lot will come up very, very quickly. I think that we look certainly within Northern Ireland at the mental health services, and there is an absolute massive drain on those at the minute, that the need massively outweighs the service provision that is there. And I think that we're going to see an increase in that. A lot of relationships, as I say, will have, friendship groups will have fallen apart. There will be realignment. It will be a real time of stress for young people. So I think there is an onus on us as an executive and an assembly to be able to respond to that. Let's just take that as a given. And I do see initiatives, for example, within our Department of Education, where they made millions of pounds available for the summertime. And I was, as a former youth worker, I was delighted to hear the terminology of just activities, just provide social, fun activities for young people to be able to learn how to re-engage with other young people and within groups, and to help find their own personality and their own identity, and then to be able to take that by September time and reintegrate back into school fully. Whenever I certainly was in youth work, it was about targets, it was about aims, it was about objectives. You were constantly looking at a young person and thinking, what bits of paper can I fill in, looking at this young person to be able to justify the funding that we get to be able to work with young people. So it was great to hear that those sorts of initiatives are there, but we're going to need to see more of that, which is, that government stepping in and saying, the whole thing about outcomes and what young people are gaining and getting and evidence gathering. Let's just let young people be young people and provide those opportunities. And hopefully that will help to get them back on the road again to normality. But it's going to take a long time for some young people to get used to that.
For sure. Yeah, thank you for that. I'll stick with you for kind of moving into our last segment, and we might go over just a couple of minutes because the segment is about the vaccine. So Colin, what vaccines are being distributed now in Northern Ireland, and who is able to get them? I know that you guys are reaching certain thresholds of the population getting their first or both shots. So which ones are you guys getting, and who is able to get them?
So look, Northern Ireland is world leaders at most things, I would like to think, and in terms of the vaccine rollout, we are absolutely way up there. The system that has been put in place has been fantastic. I think we're looking at this stage well into the 60% of people that have had their first vaccination. Round about half of that maybe that have got their second jab. I certainly have had my first one. I'm due to get my second one at the end of June, which is the 12-week period later. We have regional centres that have been established where people by age group, by age band, starting with the older population and working down in 5-year age bands. Today, the facility was opened for 25 to 29-year-olds. So we are working our way down. Now, one slight concern can be that as we're moving down the age groups, not 100% of that age group is actually availing of it. So there will be a job of work to make sure that vaccines can be made available for everybody in the community, and maybe having to bring it down into the community for those younger age groups to avail of it. Literally, if it's available on a street corner, they may be more inclined to go and get it than having to travel maybe 20 or 25 miles and get 2 buses to go and actually avail of it. So if it can be made very accessible, then they will use that. In terms of, did you want to know the actual vaccines? As in, we have the AstraZeneca and we have the Pfizer, and the Pfizer one is being made available to those under the 40 age bracket, because there has been some worldwide concerns about the impact of that. So the under 40 age group are generally availing of that, and those that are in the other age groups are getting mixture between that. And I think there is a third vaccine that is also been rolled out, but I'm going to show my age and show that I've forgotten the name of the third one that we have. But I got the AstraZeneca, and the Pfizer has been mixed age groups, but now will be given to the younger age groups.
Okay, thanks. Yeah, well, I'm curious about you're saying about reaching out into the communities. So Paula, do you know, is there a degree of hesitancy in different sections of Northern Ireland that people that perhaps don't know if they want the vaccine?
I haven't seen that, certainly in the area that I represent. I think we have had an excellent uptake of the vaccine from all age groups so far. Of course, we do have those people out there that are anti-vaxxers that you'll get anywhere. They are there, but they really are the minority here. I've also had my first, my second one's due in the beginning of June, and mine was the AstraZeneca. I've a daughter at 31 and a son at 29. My daughter got the Pfizer, and my son just booked today for his Pfizer. So, and didn't need to be prompted in any way to go and do it, because they felt they wanted to do it. And I think as well, as we look at opening up in the summer and the possibility of going away on holiday, where you may need to actually have that type of COVID passport. My dog has now decided to start barking. So I, just to finish off and say, I haven't noticed it, and maybe Colin will know more with being on health committee, but certainly I think the uptake here has been brilliant. Absolutely.
That's great to hear. I think your dog was like, yes, go on holiday, give me the house. I want it to myself. Well, just 2 last questions. Kiva, considering that at this moment, perhaps some EU countries, their percentages of vaccinations are lower, will this discrepancy, do you think, impact trade and economy? And how can Northern Ireland prepare for that?
I'm having trouble with my mute again. Apologies. No, as has been said, our vaccine rollout has been excellent. So it has down to 25-year-olds today. And I think, you know, huge recognition and gratitude has to go to all involved in that rollout. And we have volunteers who go to the vaccine centres and help with that as well. So it has been a real community effort in terms of that rollout. I think what we're beginning to see is other countries catching up, which is a good thing as well. Obviously, our closest neighbour is the south, where, you know, there's 2 jurisdictions on this island, and this week in the south, it's down to 45 to 49-year-olds can now register. So we are beginning to align. But I think, and it's probably, in my view anyway, there hasn't been as a joined up as an approach across the island that we maybe would have liked to have seen over the course of this. And I think it is really important that we do try to advocate for a very coordinated approach across both these islands because of our politics and proximity. Travel has been allowed in and out of the north for work purposes, for essential purposes, but it has been very limited for anything else. And you can just today, there have been some announcements about relaxation of travel within the common travel area. So that's Britain and the island of Britain and the island of Ireland. So people can begin to travel for visiting purposes. So that's just new. So that hasn't happened yet. So in terms of the impact on the economy or business or trade, there have been some issues, and certainly there were back in December and January time, there were some, particularly in December time, when restrictions were being reimposed, there were some problems with the travel, and I think it was very high profile at that time. For example, when France had stopped allowing people from England into France because of the variant that had become prominent in the southeast of England. So there were instances like that. There haven't been since then. And obviously that's something that, you know, there will have to be a very close watch on over the course of the next number of months. And I think, you know, we're all very aware of the potential for there to be variants. And I think the big fear is that there would be a variant that is resistant to the vaccine. And so I think it is really important that there is that equity in supply of vaccines globally. And I think that that's something that is a global community that we really need to be looking towards, because, you know, if there is one part of the world that is vulnerable to this virus, then, you know, the entire globe is as well, because, you know, we are very transient people at this time, you know, and it is the reality that, you know, people just move around. But I think now that we are moving to this place where things have opened up, people are beginning to look towards the summer, people are beginning to think about holidays. I think it is, you know, I guess a sign of progress, but I think there is just that degree of caution that definitely needs to be there. And I think that will be there.
Yeah, absolutely. And I guess just to round it out, I'll ask Colum. So if we get, you know, herd immunity in Northern Ireland, that's what we call it here. I don't know if you're using the same term, but if you get that threshold of people vaccinated, is there still concerns about non-vaccinated people visiting Northern Ireland? Or do you think that so long as we can reach those numbers of getting vaccines across the globe and trying to prevent these variants, are there other concerns that the Health Committee is looking at?
Yeah, thanks, Natalie. Yeah, absolutely. We live in a very interconnected world, and actually, as Kiva touched upon there, we ourselves are an island of travelers. I mean, we have huge diaspora in the United States. We have huge amounts of our young people working in Australia and the United States presently, working in Dubai, teaching out there. And we also have a very, very dynamic and a hugely valued several different populations of people who live and work here, who have come to Ireland and to the north and to my own constituency over the past 10 or 20 years. And just one sort of tragic example of that is the first person from East Timor or Timor-Leste to die as a result of COVID died here in my constituency in Dungannon, which shows you the interconnectedness of the world. So we have to be conscious of that. We also, and again, I welcome we have a very highly developed pharmaceutical industry, and actually there's an announcement today that Pfizer is going to be manufactured here in Ireland. But I'm involved in a campaign that's currently running to seek 1 million signatures across Europe to call for the right to cure for everyone, and that there should be no profiteering on a pandemic. So The world needs to work together. This is a pandemic, therefore it needs a global response. And I'm always struck by the fact that we had our first case of COVID on the island of Ireland on the 27th of February. A person who travelled into Dublin Airport and travelled on public transport back to their home here in the north. So as Kiva says, while one person anywhere in the world is at risk, we're all at risk. And actually there's even a more fundamental danger. And that's that with a patchy rollout of any vaccine or any type of attempt to achieve herd immunity via a vaccine program, if that's patchy in different countries, and we can see what's happening in India in recent weeks, it allows the virus to mutate and to get a kind of a first look at a vaccine and to work away around that vaccine. So we have to be really, really targeted and focused and forensic in how we deal. And we cannot allow this to become a Western solution and allow lesser developed countries to continue to suffer, because that's not humane for a start, but also it doesn't make sense even for selfish reasons. So I think we need to be very, very clear that while one person remains at risk from this or any other highly transmissible respiratory disease, then all of us are at risk, and we need to deal with it in that fashion.
Of course. Thank you so much. And thank you, everyone. Thank you for your time. I know that, again, you guys are all incredibly busy, but this has been very enlightening, I think, for myself and hopefully for the members of our audience. So just thank you to each of our speakers. And we hope that in the future we can engage you once more, perhaps on a different topic that is not pandemic related. As well, for our audience, just to mention, as our exchange work transitions to virtual engagement during COVID, it's vital that we measure still the impacts and effects of these virtual town halls. So to do this, we ask that our audience members complete a brief exit survey. It is very short, and the Zoom attendees can view the survey link on the post attendee screen, and then you might also receive it in an email, as well as the viewers on Facebook can find the survey link in the video description. So once more, thank you to our panelists. Good luck with everything else. I hope that it's only good news from here on out and that you have a lovely summer with very long days. Thank you.
Bye-bye. Goodbye.